everyone, this is Tiffany, and I am reporting from EULAR 2025 in Barcelona, Spain, person living with non-radiographic axial spondyloarthritis, which is one reason that this session was of primary interest for me. People living with spondyloarthritis diseases like axial spondyloarthritis and psoriatic arthritis often deal with something called enthesitis, and that is the area where the tendons, ligaments connect to the bone and it becomes inflamed. And that is the pain we often feel, even more than joint pain, in our diseases. And so we've been seeing enthesitis being studied more and more over the last couple of years. And this time it was talking a little bit more about different ways of tracking onset of enthesitis, what could cause enthesitis, and then going in that direction to see how to target treatments to match that pathway. And so in one of the reasons for doing that too, that I think is worth noting, is in these spondylitis diseases, we often go to the doctors and we're still talking about joints. And enthesitis, actually, when that is inflamed itself, the enthesitis, because it's right next to the synovial tissues and it's right next to the bone, inflammation of the enthesitis can actually lead to inflammation of the synovial tissues. Synovial tissues lead to the joint damage. So in a roundabout way, joint damage can happen through cycling through enthesitis. Then equally, the enthesitis, as it's inflamed, can work its way into the bone. Okay, so in saying all of this, they started the presentation by talking about an onset that we know exists in many of our diseases, and that is gut inflammation. And they were using that specifically as a comparison to think about these, again, different treatment pathways, things that we should be looking at where inflammation starts and then how the inflammation spreads. That was sort of the big theme here. And so in gut inflammation, we know about 60% of patients with psoriatic arthritis will have some kind of what they call subclinical diagnosis of a gastrointestinal issue. And subclinical just simply means that it hasn't really developed enough to be one full diagnosis. And so in saying that, we know that the gut, it migrates outside of the system, and that's the environmental trigger that starts our diseases. And so then they also made a note that even though about 30%, they say about 30% of patients with psoriasis develop into psoriatic arthritis, people with psoriatic arthritis, whether it started with psoriasis or not, those with psoriatic arthritis, of those 80% will experience psoriasis. So whether it just started as psoriatic arthritis with the whole psoriasis onset or was psoriasis first and developed, it's about 80% total that will have the psoriasis. And because of that, they felt if you observed the skin lesions, in particular in psoriasis, and the genes and the cells, the T cells in particular, that are responsible for chronic disease and live in the skin lesions, that following that path through the skin, the inflammation then crosses barriers and can affect inflammation of the enthesitis. So the enthesitis being, that ligament where the ligaments and the tendons are connecting the bone. And so this enthesitis then also, once that is inflamed, so it's like this chain reaction that they were studying. Once the enthesitis is triggered, then the enthesitis could lead to synovial tissue inflammation. Synovial tissue inflammation leads to joint issues, so joint deterioration. It also can lead to bone deterioration. And so when we see the bone deterioration, in particular in these diseases, then we've got this whole kind of, so the idea was if we can identify if the skin lesions are potentially a primary driver of inflammation. So let's just move away from the gut bacteria for a minute, and we look at psoriasis and the skin lesions in particular. If we can follow that chain of event, then possibly we could match people with significant or treat to target, like you might respond better to a TNF inhibitor or something, et cetera. So it was just a different way of thinking about research. And I believe it had mentioned, and I'm going to say I missed the first 5 minutes of the presentation. So I believe that they said also, because they ended the conversation too by saying it would be important to continue studying the number of psoriasis to psoriatic arthritis, things to watch. And so would this be something if people are complaining about psoriasis plus this enthesitis and being able to better diagnose enthesitis, could that then improve the diagnosis to psoriatic arthritis? So that is the link. And so they talked a little bit too about differentiating enthesitis from mechanical injury or overuse. So similar to we hear about joint inflammation where it could be from overuse, excessive pressure on the joint, or it could be from disease. It's the exact same with enthesitis. So enthesitis, that inflammation between the bone or the tendon ligaments, that also can happen from overuse and injury. So just making it, is it from that or is it from disease? If you can rule that out and say it's from disease, plus you have this psoriasis, then in addition to the pathways of having the skin go through and infiltrate the inflammation to the enthesitis, and we could study those patterns of the cells that connect the two, then we could have a better treatment plan, but also could it be something for diagnosis? So that was just something that I really found fascinating. You can see many other previous Go With Us where I talk specifically about enthesitis. It's been a very, very hot topic here at the conferences, which means it's something that's being studied more and more, which is exciting in spondyloarthritis.